Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
A patient was intubated and immediately EtCO2 rose and airway pressure also rose. First the patient is intubated, then immediately EtCO2 rose and airway pressure also rose. What is the cause? And on auscultation, we can see faint respiratory sound is heard faintly. And this faint respiratory sound is heard faintly bilaterally. Now, what is the diagnosis? The patient is intubated, EtCO2 increased, and airway pressure rose. So, that means there is some issue. So, the respiratory sounds are heard faintly bilaterally. So, there is issue in respiratory sounds also. So whenever there is increased EtCO2, the graph is like this. It is upsloping pattern. Plateau is seen. There is raised airway pressure. Faintly heard respiratory sounds signify that there is decreased air entry. Decreased air entry with increased airway pressure, increased CO2 means there is bronchospasm. So this is a case of bronchospasm.
thank you and thank you for watching.